and welcome to the Dementia Doctor. Today I'm going to talk about a very interesting condition called as anosognosia, and we will talk a little bit into detail in terms of how this condition can lead to a lot of arguments, disagreements in the family, difficulty for the person suffering from dementia to participate in their own care. Now, it is not uncommon that I have families who will bring a family member who believes that they should not be coming to see me, who believes that their family is making up that they have dementia. Or when we do the consultation, sometimes the family members, as well as the individual who is suffering from cognitive issues, get into an argument in the clinic. And when I see that, I start suspecting a condition called as anosognosia. Now, it is a mouthful, and what it basically is saying is that this individual who is suffering from having memory or other thinking issues is now also suffering from another condition where they have lost an insight into their own cognition. Now, as crazy this idea sounds, it's actually something that I see very commonly in the clinic. And I did bring a brain model with me to show you where exactly is the issue happening. So our frontal lobes are very smart, and especially the prefrontal cortex, which is typically involved in monitoring yourself, in understanding where should I stop, in kind of self-managing and giving yourself a feedback. And when we have dementias that affect the prefrontal cortex and the frontal lobe, and sometimes even on the right side, the junction between temporal and the parietal lobe, that is when individuals can suffer from this condition. Now, I do think it is one of the most difficult conditions to wrap your head around, that my loved one is having these memory issues, and how come they do not see that they're having these memory issues? How can they not see this? How are they missing out that they got lost while driving, or they are making multiple medication mistakes? How come they are not able to see that this is something that is so obvious to you? And it kind of creates this kind of mismatch between the individual who's suffering from cognitive issues and the family member. And what happens is that you see this mismatch, and it kind of leads to a lot of arguments, of course, but from the perspective of the family member who's suffering from this issue, it can lead to a lot of hurt and pain. And I say this with personal experience because my grandmother was experiencing this issue, and at that time I did not understand. And so I would go and remind her, see, we talked about this. And she would get upset because in her memory and in her insight, she did not see any issues. So it kind of created a divide between us because I, in my best intentions, was trying to help her. On the other hand, she saw that nothing was wrong with her. And that kind of leads to a lot of hurt feelings from both ends. The person who's suffering from the cognitive issues, as well as the loved one who is trying to help them. So oftentimes families will ask me, what should we do if we are noticing these lack of insight where dad just goes and he denies making any mistakes while driving, he is getting lost, we have fender benders, and or mom gets upset when I bring up that you're having memory problems. How do we deal with the situation? So because it is something that is related to your insight, and because it is something that doesn't have a cure by itself, what we do is we think about strategies of communication. So say if I feel that this is what is going on, so say if I detect that this is what is going on in a family dynamic or interaction, I often educate them and say, well, if telling your loved one that they're forgetting is not helping them and is hurting their feelings, their self-confidence, then it's probably just better to say, oh, let's go to the doctor, it's at 8 a.m. instead of saying, see, I told you and you forgot, and we need to go to the doctor at 8 a.m. So there is a difference between this communication where we might need to repeat the communication again and again, but we don't prefix it by saying, oh, I told you so. I've told you so many times. I told you last night. If we leave that part out, it is easier on us as well as our loved ones, because all they get is the information they're seeking, and they don't get that extra information that they anyways cannot see because of their disease. Now, oftentimes when I tell families about this condition, they say, is my family member in denial? And I say, no, this is not denial. This is not purposeful. It is truly a part of their disease that they're not having an insight into their own cognitive issues. Now, as difficult as it is to understand and wrap your head around, imagine it from the perspective of the individual who's suffering from cognitive deficits. They think that they're doing everything right in their day-to-day living, and here there are a bunch of family members all after them trying to say that something is wrong with them. And out of all things, it is something that is so close to their self-respect, their independence, and their personhood. So when we think from that perspective and we understand that it's truly a part of their disease and it's not in their hands, even if they try their best, then we think about these communication strategies where we just say or convey the information that we want them to act on, and we don't prefix it by saying, oh, you're forgetting, or oh, I told you so. These little things that we do for our loved ones go a long way preserving their well-being and their self-confidence in themselves. So hopefully this is a video which could be something that comes in handy if you have a family member wherein you see that they are not really seeing the problems that you are seeing, and you can discuss this or show them this video to hopefully have both the caregiver or the loved one and the individual who's suffering from cognitive issues understand that this can sometimes be seen with dementias, especially Alzheimer's disease. And although it doesn't have a cure, we do have some communication strategies to help with that. I'll see you back in the next video. Till then, take care and goodbye.